Your doctor has told you that your kidneys are failing. This diagnosis is called end-stage renal disease, or ESRD. It means your kidneys can no longer do their job well enough to keep you healthy. Kidneys are vital organs. They act as your body's sophisticated filtering system. They remove waste products and excess fluid from your blood. When this function stops, waste builds up in your body. This can make you feel very sick. Understanding this condition is the first and most important step in taking control of your health and your future. It is a serious diagnosis, but it is one you do not have to face alone. The main goal of treatment for ESRD is to take over the work your kidneys used to do. This is called renal replacement therapy. This can relieve many of the uncomfortable symptoms of kidney failure, such as fatigue, swelling, and nausea. The ultimate purpose of treatment is not just to keep you alive, it is also to help you maintain a good quality of life. This means helping you feel better, stay active, and continue doing the things you enjoy. There are several different ways to achieve this, and each path is unique. Making decisions about your care can feel overwhelming. These include different types of dialysis, a kidney transplant, and conservative care. Each choice has its own set of benefits and challenges. They will impact your daily life in different ways. This knowledge empowers you to work with your medical team. Together, you can choose the treatment that best aligns with your personal health goals, your lifestyle, and your values. This journey is about shared decision-making. In this guide, we will walk you through each treatment path. We will explain them in simple, clear terms. We will discuss how each treatment works and who is a good candidate for it. With the right knowledge and support, you can make informed choices that are right for you. When your kidneys fail, you have several primary treatment paths to consider. A patient at a dialysis center, someone performing PD at home, and a person smiling post-transplant. The most common treatment is dialysis. Dialysis is a process that artificially cleans your blood. There are two main types. Hemodialysis uses a machine and a special filter to clean your blood outside your body. This can be done at a medical center, or, for some patients, at home. The second type is peritoneal dialysis, or PD. PD uses the natural lining of your abdomen to filter your blood inside your body. It is a form of dialysis that you can do yourself at home. Another major option is a kidney transplant. A transplant involves a surgical procedure to place a healthy kidney from a donor into your body. The donor can be someone who has passed away, or a living person. A successful transplant is the closest thing to a cure for kidney failure. It can offer more freedom and a better quality of life than dialysis. However, it involves major surgery and requires taking lifelong medications to prevent your body from rejecting the new organ. Not everyone is a suitable candidate, and there is often a long waiting list for a donor kidney, which is a reality we must address. For some individuals, especially those who are older or have other serious health problems, the burdens of dialysis or transplant surgery may outweigh the benefits. In these cases, a path called conservative care may be the most appropriate choice. This is not giving up. It is an active medical plan focused on managing symptoms and maximizing comfort and quality of life without starting dialysis. This approach involves medications, diet changes, and supportive care to help you feel as good as possible for as long as possible. The decision to choose conservative care is deeply personal and made with your doctor and family. This essay will serve as your detailed map to these options. We will break down how each treatment works. We will look at the day-to-day realities, including the impact on your diet, work, and travel. We will discuss the creation and care of medical access points, like fistulas or catheters, which are needed for dialysis. We will also cover common complications and how to manage them. Our hope is to give you and your loved ones the tools you need to have meaningful conversations with your healthcare team and make the best possible decisions for your unique situation. Your kidneys are two bean-shaped organs, each about the size of your fist. oxygen to your tissues. Renin helps control blood pressure. Kidneys produce active vitamin D so you can absorb calcium. That keeps bones strong and healthy. End-stage renal disease, ESRD, means these functions have fallen to a critical point. The kidneys can no longer filter waste, balance fluids and electrolytes, or produce essential hormones. This decline is usually gradual, chronic kidney disease, CKD, not sudden. When function falls below about 15%, waste and fluid buildup becomes life-threatening. At that stage, treatment is needed to replace the kidney's work, which is why understanding their function is so important. When your kidneys stop working properly, waste products and excess changes. A diagnosis can feel frightening, but it's the critical first step toward getting the care you need and protecting your health. Receiving an ESRD diagnosis means you will start working with a dedicated team Hemodialysis is the most common type of treatment for end-stage renal disease. Think of it as using an artificial kidney machine. During a treatment, your blood is carefully drawn from your body and circulated through a special filter called a dialyzer. Inside it, your blood flows on one side of a thin membrane, while a cleaning fluid, known as dialysate, flows on the other. This setup allows waste products and excess fluid to pass from your blood into the dialysate. The typical schedule involves visiting the center 3 times a week. Each treatment session usually lasts about 4 hours. This fixed schedule provides a structured routine and means you are cared for by a team of experienced nurses and technicians. Before treatment can begin, you need a vascular access. The best options, a fistula or a graft, are created surgically in your arm and need several weeks or months to mature. For individuals who want more control and flexibility, home hemodialysis offers a powerful alternative. Home hemodialysis is often done more frequently. Many patients choose to do shorter sessions 5 or 6 days a week, while others may opt for longer, slower sessions overnight. The benefits are significant. You can often enjoy a more liberal diet and fewer fluid restrictions. Many patients on home hemodialysis report having more energy, better blood pressure control, and an overall higher quality of life. However, taking on this responsibility requires a significant commitment. Before you can start, you and a care partner must complete an intensive training program. You will also need dedicated space in your home to store the machine and a large volume of medical supplies. Peritoneal dialysis, or PD, works very differently from hemodialysis. Instead of using an external machine, PD uses the natural lining of your abdomen, the peritoneal membrane. The PD process involves filling your abdominal cavity with dialysate. The fluid stays in your abdomen for the dwell time. Waste and excess fluid pass across the peritoneal membrane. After dwell, the used fluid is drained. There are two main ways to do PD. CAPD is manual exchanges. APD or CCPD uses a cycler machine that does exchanges automatically at night. Major advantages: flexibility and independence. It also often means a steadier feeling of well-being. The main risk: peritonitis, infection of the peritoneal membrane. Preventing this requires strict sterile technique during exchanges. A kidney transplant is a surgical procedure to place a healthy kidney from another person into your body. For many people, a successful transplant is the treatment option that offers the best chance at a normal, active life. You are freed from the time-consuming demands of dialysis and the strict dietary and fluid restrictions that come with it. However, a transplant is not without its significant challenges. You must take powerful medications called immunosuppressants. These drugs make you more vulnerable to infections. The path to a kidney transplant begins with a comprehensive evaluation to see if you're a suitable candidate. If approved and you don't have a living donor, you go on the national waiting list. Waiting time varies from months to many years. Surgery usually lasts 3 to 4 hours. You'll spend several days in the hospital recovering. Recovery continues for months. Learn to manage complex medications and spot warning signs. For some people, the burdens of dialysis or a transplant may be greater than the potential benefits. In these situations, conservative management may be the most compassionate and appropriate choice. Conservative management is not about giving up. It is an active medical plan that focuses on managing symptoms to maintain the best possible quality of life without the plan to start dialysis. This path is often considered by older adults who also have other serious health conditions like advanced heart disease, dementia, or widespread cancer. A key component of conservative management is the integration of palliative care. Specialized medical care focused on providing relief from the symptoms and stress of a serious illness. This approach also involves advanced care planning, conversations about your wishes for end-of-life care, ensuring that your values and preferences are known and respected. Choosing between these paths is one of the most personal and difficult choices a person with ESRD can face. There is no right or wrong answer. The best decision depends on a complex interplay of medical facts, personal values, and what quality of life means to you as an individual. Have open and honest conversations with your nephrologist and with your family. Your doctor can provide likely prognosis. Your family can offer support and help you think through priorities. Shared decision-making empowers you to choose a path aligned with your needs and hopes. Your dialysis access is your lifeline. Protecting it is one of your most important jobs. Managing your diet is a cornerstone of living well. Your medication schedule will become a central part of your daily routine. Adjusting to life with kidney failure also involves finding a new normal. Finally, it is essential to care for your mental and emotional health. Your social worker can connect you with support groups where you can talk to other people who understand what you are going through. Knowing your options is the first step. Taking action is the next. Now is the time to turn information into a concrete plan. Your immediate priority should be to schedule a dedicated meeting with your nephrologist. Build your support team. If dialysis seems likely, get a vascular access evaluation with a surgeon. Facing end-stage renal disease is daunting, but you do not walk this journey alone. It is a chronic condition that requires management, but doesn't have to define your life. There is hope, and there is help available. Your journey forward starts now with small, manageable steps toward taking control.